Hi everyone, welcome back to Allied Health 102, Intro to Phlebotomy. So we're going to move on to Chapter 6 because I know it does cause some confusion, but I do have it outlined everywhere from your syllabus to Canvas, what order we're going in. So we're going to skip some chapters and move some chapters around. So make sure you're following on Canvas and that you're following your syllabus, which attached to your syllabus is your tentative course calendar. So it will show you which chapters we're going in which order and what test, your first test will be on which chapters. So guys, let's try to remember that Intro to Phlebotomy and Phlebotomy Lab is one of the qualifying courses for phlebotomy clinicals, along with Biology 110, Medical Terminology, then either Biology 120 and 120 Lab, which is Intro to A&P in its lab, or you could take Biology 230 and 231, which is A&P 1 and 2. You do not have to take that for this course. Intro is fine, but if you decide to take 230, if you're possibly going on at a later date with your education in healthcare, a lot of things like nursing require 230 and 231, but just remember, you have to take both. You have to take both 230 and 231 because it divides up the information. 230 is mainly a lot of anatomy, and 231 is mainly a lot of physiology. But 120 just is an intro class, but it introduces you both to basic information on anatomy and basic information on physiology, and I need you to have both. So also, along with that is Allied Health 109, which is Healthcare Systems and Safety. So those are your qualifying courses. So all your other courses, whether it's a psych elective or your computer concepts class or Englishes or basic Englishes and math, you have to be able to graduate with your phlebotomy certificate. Those classes, like the computer class and the psych class, you need to make a C or better. I'm not really concerned. I want you to do, of course, the best job as you can, but they don't decide whether you're going to clinicals or not, okay? You need to pass those classes. You need to have them under your belt, or you need to have testing saying you don't need to take them, but they have to be there. But the grade you make in them is not as important as far as clinicals is concerned as those qualifying courses. And Intro to Phlebotomy and Phlebotomy Lab is one of those courses, so we want to do as well as we can because I take the grade point average of those courses, and the top 15 are the ones that get into clinicals, to get my 15 clinical slots. So just remember, that means you want to make the best grade you can, right? Now, that doesn't mean everybody has to make an A, but you want to strive for the best grade you can. The best way to do that is to make sure that you're staying up on what's coming, that you're getting on Canvas, you're looking over there to that far right, what do I got going on? Get yourself something so you can, a calendar or something so you can write down and keep up with what's coming so that you don't get caught off guard, okay? Your tentative course calendar lays out for you when the quizzes opens, when they close, what test, when it is, what's on that test. Make sure you know that. And the way you study for these tests is you will have that black binder that will have your chapter review guides in it. You take those chapter review guides, you read your text. The chapter 1 PowerPoints were up. You read chapter 1, you watch that PowerPoint presentation, you have your chapter review guides out there right next to you, and as you're watching this PowerPoint presentation for chapter 6, you'll have chapter 6 review guides out next to you. You fill in those chapter review guides, and then you take the review guides for the chapter, once you finish them, that are on that test, and you study those chapter review guides. That's where my test comes from. But if you want an A, you read that chapter, watch these PowerPoints, fill out the chapter reviews and study them. If you do that and you put in that time to actually study that and those listings, you will be successful in this course, okay? So let's get started. Again, as I said before, I'm going to move through these relatively quickly because you can pause them, you can rewind them. This is an accompaniment to your textbook. This is an accompaniment to you being able to fill out your review form. So I'm not going to read this stuff word for word. You don't need me to do that, okay? But we always start off, so chapter 6 is, a lot of you have either already had medical terminology and anatomy and physiology, or you're taking it right now. So this will be just kind of a refresher on these subjects, okay? And as always, we have our learning objectives, which are also listed in the front chapter of your textbook for each chapter. And these are important because this is what you should be able to do once you've completed this, okay? And you need these objectives, so you'll see what your objectives are for yourself once you finish this chapter, okay? It's going to be everything from being able to define words commonly used in the lab to discussing disorders of each body system, okay? Because it's important that you know that. Okay, so let's get started. Okay, so the first thing we want to start with is our body, right? So, because how are we going to be able to learn disorders of our body if we don't even understand our body, right? And like I said, this is an anatomy and physiology overview because you are either taking or have taken anatomy and physiology. So this really should be either an accompaniment or a refresher, okay? So we know that the human body is broken down and divided into 8 structural levels, right? You got your atom, which is the basic building blocks, right? So you have hydrogen atoms, oxygen atoms, okay? Those are that smallest part, right? And then you take those atoms and you can combine them together to form a molecule. So one molecule of water, right? H2O. Then we have organelles, right? Inside there's the nucleus, your lysosomes, and there's other organelles in that cell. That they all come together to build that cell, right? That's our next level, is a cell, right? And you have different types of cells, like a nerve cell. And then cells can band together to form tissues, right? Such as skin. And then those tissues build our organs, like our stomach, or our heart, or our lungs. And then we have what we refer to as organ systems. So that's when we take something like our stomach, along with our small and large intestines, our esophagus, we put all those together and we see a digestive system. These are the organs that work together to digest our food. And then all the organs come together, all this stuff comes together to make an organism, right? Either a man or a woman. Okay, so now you have this organism, and the body is a wonderful thing, and it wants to keep homeostasis, right? It wants to remain the same. It knows what its steady state condition is. This is the condition that's most optimal, right? So how does that work? Okay, so and as an example, I'm a person who I like to try to drink plenty of water, right? We need plenty of water. You don't want to be dehydrated, right? But one of the, I call it inconveniences of staying very hydrated, drinking the amount of water throughout the day that you need, is that when your body sees that you've taken in all the water it needs, it's going to get rid of that excess water in the form of having to go to the bathroom, right? So if you drink a lot of water throughout the day, then you're going to have to go to the bathroom a lot, right? We sweat. Sometimes if you're out exercising and it's a hot day, you're going to sweat because it's your body's way of trying to get that temperature down and keeping your temperature in that normal range. We know what our normal temperature should be, and our body tries to keep our temperature directly in that normal range. If it gets too high or too low, it could mean if it gets too high, you could be sick, and it's your body's way of trying to kill off an organism, but it also means you're not well, right? You might have, they call dis-ease, right? Disease, dis-ease, I'm not at ease, right? And so you're sick, so that temperature is out of range, and so your body's going to do everything it can to get rid of that bacteria or virus, and then get your temperature back down to normal as quickly as it can, right? So these are ways, there's lots of ways out there, and we'll go over other ways that your body does things inside itself. Constantly it's working, right? It's working and working to keep you in a steady state condition. So metabolism, catabolism, and anabolism, right? These are all processes that go on inside your body, right? And metabolism, that's that total process, okay? Because anabolism and catabolism are the two things, like you see them on opposite ends of the spectrum, that are working together, right? As a whole, that's your metabolism. And I know y'all hear that word a lot out there, you know, whether you have a high metabolism or low metabolism. But think about it like this, you know, most of us, and you can have this tested, you want to know how many calories you burn at rest. And in other words, your resting metabolic rate. That's the amount of calories your body needs while it's really not moving a lot. This is not when we're exercising or walking or running or anything like this. This is what it needs to just breathe in and out, beat your heart, your brain processes, your digestive processes. All these processes that are going on inside your body, they release energy, they take energy, right? Okay, so they take energy to do it, and then some of them release energy. So you think about catabolism. We talk about a cannibal, right? You're eating something and breaking it down. You're chewing it and you have to break it down. Well, this is a way that it takes something like sodium chloride, breaks it down into the two separate parts of sodium and chloride separately, right? But it takes energy to do that, okay? So you need energy to be able to break these things down, okay? And so then when you talk about anabolism, it's the process which chemical reaction the cells are used to build up, right? Compounds. And you use energy to be able to do that as well when you take them and combine them back together. So you need to look, that's a process that goes on all the time, breaking down and then building up of chemicals inside your body to keep you in a normal, steady state. Okay, so again, make sure you read through this, make sure you're filling out your review guides, okay? Okay, so as healthcare workers, there's things that we can do to assess your homeostasis in your body, right? That's why we take vital signs, okay? Because blood pressure, temperature, pulse, these are all things, respiration rates, that our body tries to keep within a normal set range, okay? So when we take your temperature, and that can tell us, that can answer a question for a healthcare worker that you're not in homeostasis, you're in disease, right? Something's going on. You may have a bacterial infection, you may have a viral infection, something's going on inside your body, and that's a clue to us that something's out of whack and we need to take a better look, right? Your pulse, right? You should fall inside a certain range depending on your fitness level, okay? Same with respiration rate and blood pressure. We know that one of the big problems we have in this nation today is we have too many people with elevated blood pressures that are hypertensive, and it causes a lot of other problems, because that's why your body wants to get back to that steady state and keep your blood pressure at its almost optimal range. Because if your blood pressure is too high, it causes a lot of other issues inside your body. And our body knows we don't want that. We want it in a normal state. And so that's why if you get to a point where your body is now unable, for multiple reasons, to keep your blood pressure at a normal rate, physicians may prescribe, hopefully temporarily, some medication to you to aid your body in being able to get your blood pressure down, right? And we play a vital role as healthcare workers in the collection, processing, and testing of specimens. All different kinds of specimens, not just blood. That's the main one we think of with phlebotomy, but there's collections of urine and other body fluids like synovial fluid and things like that, bone marrows, that provide a wealth of information to our doctors, nurses, physicians assistants, that help us identify issues with organs and organ systems so that we can diagnose disease, We can treat patients and monitor patients based off the results we get off of these specimens that we test, right? And so you got to remember, as we go through this, you'll learn this. We learned some of this in chapter 1. We'll continue to learn this. If there's multiple aspects of this, right? That's why when you're checked into a hospital or you go to your doctor, they're going to always get your family history, right? They're going to get that history and physical. They're going to know your history of yourself and your family. What surgeries have you had in the past? What issues have you had in the past? Have you ever been diagnosed with hypertension? They're going to weigh you to see if you fall into a good, healthy weight. If not, that's an issue that they may want to look at and try to take care of to help you get back down to a healthy body weight. They're going to take vital signs to see if your blood pressure is normal, to see if your temperature and pulse is normal. These are all things we use along with diagnostic testing like lab results and MRIs and x-rays, all put together to tell us a complete picture and help us diagnose, monitor, and treat our patients. So we went over this in chapter 1. These are some of our little slides that really help us take all this information and be able to put it together. So what I'll do going forward is I'll just, I'm not going to read each one of these to you guys. You can do it, but this is a good way for you to study and see if you're learning this stuff and putting it together. You can always pause this, see if you get the correct answer, peek back at your notes to see where it's at, and it's just a really good, helpful study tool. So make sure you use these to study. So I'll read this first one, and then as we come across other ones, I'll just pause, and you guys can pause, and you can go through them yourself. So in this one, we're talking about, is hydrogen an example of an atom, molecule, or organ? And it's an atom, right? And if you take a hydrogen atom, mix it with 2 oxygen atoms, you can get a molecule of water, right? Okay, so now we're moving on to the anatomic regions and positions of the body. And these are important when you're talking about patients, if you're charting on a patient, if you were describing something about a patient to another coworker. These are vitally important. You need to understand these and know what they mean. So we start off with the normal anatomic position, right? That's a erect standing position with your arms at rest and palms forward. Then you have supine position, which is laying face up. And we note that this is the best position for phlebotomy, okay? You have a prone position, which is laying face down. And then you have a lateral recumbent position, which is laying on the right or left side, okay? So you want to stop this right now, stand up and see if you remember, because that's how you know if you're really taking this information in. Stand up and see if you can do a normal anatomic position. So just some background information. Biopsy, right? That's a small piece of tissue. Like they go in and they do a biopsy if they find something, some kind of lump, some kind of mass. They may go in and take a small tissue of that, and then they're going to biopsy it, right? And that's where a doctor, usually a pathologist, will look at it. So your surgeon may go in and cut a little small piece of that tissue from some body part, whether it's a breast or a lung, and then a histologist will make a slice of it and then stain it, and then the pathologist will come in, look at it under the microscope, and he can determine through he has ways of determining from looking at that piece of tissue that's been stained whether it's cancer or not, and some kind of what stages it's in, what type of cancer it is. So remember, it just starts with that biopsy, which is that small piece of tissue that a surgeon takes out from a body part. Then a histologist that works in a lab will make a slide, stain it, and then the pathologist, okay, will look at that under the microscope and determine whether it's cancerous or not. So cultures, okay, this is where you can culture something is grown on a prepared media. Okay, so there's a prepared media. Sometimes it's a liquid media, sometimes it's a gel media. If you look at these pictures accompanying this slide at the top, that's Streptococcus. Streptococcus growing on a blood agar medium. You've seen those round Petri plates. And then to the other side, you can see it gram stain under a microscope. Same thing at the bottom, that's Staphylococcus. So that's strep at the top, staph at the bottom, right? And you get that it grew out on the media, then you can stain it and look at it under a microscope. And it helps us to diagnose a patient with a strep infection or with a staph infection, okay? So whenever you see the term culture, it means that a healthcare person has swabbed an area of a body, like a throat or an incision, sent it to the microbiology section of the lab. So that helps you understand that cultures go to the microbiology section of the lab. And then a technologist that works in there will take that specimen, that swab, spread it on a culture plate and grow it overnight at body temperature in an incubator that's set to 37 degrees, because we want to mimic it's growing inside your body. So we want to mimic what's going on inside your body. So we will help this grow on this media so that we can then look at it under the microscope and determine what type of infection you may have. So now let's look at disorders and the laboratory tests that go with these disorders for each of the organ systems. So we're talking about the integumentary system, which is your skin, right? And we're talking about disorders of this system. So things from acne all the way down to skin cancers like malignant melanomas and everything in between, right? And so we want to look at these disorders that could happen to your skin and what are the laboratory tests that can be done to diagnose, monitor, and treat these particular disorders. So the laboratory tests we can do for these are they can scrape an area of the skin, then they can do cultures of it for looking for funguses, viruses, bacteria. There's a potassium hydroxide, which is a KOH prep that they can do that looks specifically for fungal infections. And of course, there's the biopsies that we talked about. They can take a biopsy of that skin and go through the same process. They can make slides out of it, stain it, and the pathologist can look at it under the microscope. So just to do, like I said, a lot of this is a refresher for you guys, and this is a very good picture that really detailed, that helps you understand your epidermis, right? Your dermis and your subcutaneous. Those are the three levels of your skin. So when you think of skin puncture, it must reach down to the dermis where the blood vessels lie. Because you see in this picture, it highlights where those blood vessels are, and it shows the dermis. And so it shows that you've got to get down to at least that dermis level to be able to tap into that blood vessel to be able to draw your blood. Epi means above, right? That's why medical terminology is so important. It is like the keys to explaining to you what this stuff means. That's why taking med term and really concentrating on it and understanding it's vitally important. And then sub, like a submarine, right, that goes under the water, means below. So subcutaneous, below, epidermis, that means above, right? So moving on to the skeletal system. So again, we're going to do each one of these systems. We're going to talk about diseases and disorders of that condition, and then what type of laboratory test results can be done that can diagnose, monitor, or treat this particular condition. So when we're talking about our skeletal system, we can talk about inflammatory conditions such as arthritis, bursitis, and gout, right? Then you can have infections of the bone, and we'll talk about that as we go forward, because that's one of the things as a phlebotomist you want to avoid, hitting any bones with your needles, whether it's a skin puncture with your lancet or a needle, because you can get bacterial infections of the bone, osteomyelitis, okay? And then a porous condition to the bone, where the bone's not as strong as it should be, is osteoporosis. And then we have developmental conditions. This is whether it's due to a lack of a certain type of vitamin or mineral, or whether it's some type of genetic disorder that causes things like giantism, dwarfism, and then things like rickets can be caused from dietary issues. And then there's things like bone tumors. We talked about that, right? So make sure you read through these and you're filling out your chapter reviews. So talking about different laboratory tests for your skeletal system, calcium and phosphate are two tests that we use to check if those are building blocks in your bones. Alkaline phosphatase, that ALP, uric acid, vitamin D. And I know y'all have heard before, sometimes you can be getting a lot of calcium, but if you're low on vitamin D, it causes you not to be able to absorb that calcium. Your erythrocyte sedimentation rate, that ESR, which we'll do one of those in lab, that's a telltale sign of some type of inflammation. It's a nondescript, so that test is not going to tell you where that inflammation is, but it will tell you if you have a lot of inflammation. We can get a lot of information from your complete blood count, microanalysis, and then cultures of bone marrow and synovial, which is joint fluid. So moving on to your muscular system, these are those disorders. There's lots of disorders, things like atrophia, which is wasting away of the muscle. I know y'all may have seen this before. If any of you, your children or sisters and brothers or someone, friends, had a cast put on one arm and they had their cast on for a long time, and then once they eventually had their cast removed, a lot of times if you hold those two arms up to each other, the one with the cast on it is going to be a little bit smaller, or sometimes significantly smaller than the other arm, because you had a little bit of wasting away of that muscle because you weren't using that arm. That's why it's so vitally important for all of us to not only to stay healthy, to get some cardiovascular exercise like walking briskly or running or riding a bicycle, so you can get your heart rate up to strengthen your heart and your lungs, but also to do some type of strength training, because we want to keep our muscles strong in there. We don't want them to waste away because they help us, right? They help us stay strong and be able to lift things and do things. And remember, your heart's a muscle. You want to work it out as well. So moving on to these diagnosis tests to diagnose, and then we also use these tests to monitor and treat our patients, right? We have muscle enzymes, okay? Creatinine phosphokinase, CK, and there's a CKMB. There's one that's specific to the brain muscle, so you can see if there's some damage to the muscle in the brain. There's specific to the heart muscle, to where if there's been damage done to the heart. And then there's other tests that we have like LDH, lactase dehydrogenase. These are other tests that we can do dealing with damage to muscle, okay? You have autoimmune antibodies that can be tested to see if you have rheumatoid arthritis, things of that nature. And then you can look at those biopsies of the muscles under a microscope examination to see if there's issues. You can culture those biopsies to see if anything's going on there. And then there's, of course, a myoglobin test to show if there's a breakdown in that muscle. So again, read through these particular slides, pause them, and see if you're getting these answers correct. They're really going to help you on the test if you use these as a training tool. Okay, now moving on to the nervous system. Infections like encephalitis, meningitis, tetanus, polio, right? All these things, down to multiple sclerosis, Parkinson's disease, cerebral palsy, all these things are disorders that can affect your nervous system. And we need to understand that these are the ones that go with the nervous system. And then we want to talk about, okay, these are the disorders our patients could possibly have. And these are the tests that we will go in and draw blood and bring it back down to the lab, and the lab techs will run, or the histotechs and the pathologist will run these test results, give these results to the doctors. He will use them along with vital signs, along with history, along with lots of other things, other diagnostic tests like x-rays, to put it together as a full picture as to what is wrong with the patient so they can make a proper diagnosis, and then they can monitor and treat that patient for this existing disease or disorder, okay? So diagnostic tests of our nervous system. We can do chemical analysis for drug interactions, hormones, proteins, and enzymes, okay? We have different kind of receptor antibodies like acetylcholine, and you look for some of these antibodies in your cerebral spinal fluid. You can do all kind of cultures for viruses, funguses, and bacteria to see if these are things that are causing issues with the nervous system, because you can have some type of chemical issue, whether it's something you're taking, a drug or something that's off in your system. Okay, maybe you're not building a certain protein correctly. You're missing something needed to build that protein, and without that protein, it's causing problems in your nervous system. Okay, and then of course, dealing with bacteria, viruses, and fungus can always cause issues. And then we look for antibodies inside that cerebral spinal fluid that will give us a key to things that are going on inside that nervous system. And we always want to make sure, we talked earlier about the skin, right? The epidermis, the dermis, subcutaneous, right? We want to make sure that we understand, and we'll go through this in lab, and I'll train you. You want to get deep enough to get to those veins so that you can collect your blood, but you want to avoid hitting bones because it can cause infections in those bones, osteomyelitis, right? And you also want to avoid any type of nerve damage. That's why and you'll see this when we're in lab, we do not dig around. Excessive probing or having the patient in unsecure positions so that they jerk their arm. We make sure we secure our patients. We make sure that we're set up correctly in the beginning before we ever draw blood, and we make sure that we don't dig around because we could hit a nerve and cause nerve damage. So moving on to the respiratory system. So again, there's infections that happen inside your respiratory system, like TB, like pneumonia, right? These are the infections that can occur, and there's tests that we can do to catch each one of these particular respiratory infections that's occurring, including the flu. Then you have respiratory distress syndromes, okay? Like, I know you've heard of people having emphysema, COPD, chronic obstructive pulmonary disease. These are issues, asthma, and then there's, of course, cystic fibrosis. And then you can also have tumors inside your lungs that will cause issues with respiratory. Moving on, like I said, you'll see the trend here. Why it's so important to take medical terminology and anatomy and physiology is because you use that information to be able to understand. You want to understand that when you have an order for arterial blood gases, what is this for? Okay, you're going into that patient's room, you're looking for respiratory issues, right? Okay, so these are some of the things that the tests that are done if our doctor suspects that there's a respiratory issue, or if our doctor has already diagnosed them through a lot of this testing to have COPD or asthma or emphysema or cystic fibrosis, and now they're using these tests to monitor and treat their patients, okay? So make sure you go all through these, all the way from, like I said, those ABGs, all the way down to things like CBCs, TB skin tests, and drug levels, right? Because we all get our TB skin tests done each and every year if we work in healthcare, because we want to make sure that we haven't been exposed to TB, because then we don't want to go along and expose other co-workers or patients to TB. So then moving on to the digestive system, okay? And so you want to know all the parts of your digestive system, from the oral cavities, your oral cavity, okay? And that's why dental caries, you know, if you have, you go to the dentist and they find out you have a cavity, that's why you want to get rid of that, right? You need those teeth. They're vitally important for multiple reasons, because If it's just so easy to get an infection into your bloodstream, which then could go to your brain, your heart, anywhere, if you're not taking good care of your teeth. Good dental hygiene is vitally important. It plays a key role in your overall health, okay? Okay, so start in the mouth, right? There's issues with the mouth, right? Then you got stomach issues and issues that affect your esophagus from acid reflux. I know you've heard that if that acid builds up and backs up into your esophagus, it could cause issues with your esophagus, right? Ulcers, things of that nature. You have intestinal disorders, whether they found a polyp that they need to remove in biopsy, or whether you have some maldigestive issue or malabsorption issue. There's, of course, cancers, on and on. Then there's liver inflammation, which is your hepatitis. You can have stones in your gallbladder and have that flare up and cause issues. And then, of course, bacterial and parasitic infection. We all know about food poisoning, right? Salmonella, E. coli. We've heard of recalls on beef, where that's why it's important that you cook your meat all the way through to the appropriate temperature so that you can kill any of those bacteria or parasites it could possibly be in that meat, so that then you don't digest it and get food poisoning or get sick, right? There's things like cholera, and then there's Giardia, which is a certain parasite that you can get from food and water. So we want to know about all these types of disorders. And then again, what are the lab tests that we can do to diagnose, monitor, and treat our patients, right? Everything from tissue biopsies all the way down to O&Ps, ova parasites. This is where we do analysis to find out if there's worms, eggs, or worms and eggs in there, right? Just a little thing to remember, bilirubin, right? Elevated levels of bilirubin usually indicate a disorder of the liver, okay? And as we go on, we'll talk about Billy lights and babies who are born and they're very jaundiced. We put them under the Billy light, and so that light can break that bilirubin down and get the baby back to its normal color. And that's an issue that a lot of infants, newborns run into, and it usually works out to be just fine. But knowing that, when you know that there's a Billy light out there, and you know a cousin or a sister that had a baby that was jaundiced, they put it under the Billy light, that light broke down that bilirubin, the baby went back to normal color and didn't have an issue at all, that's a telltale sign to you that as you're a phlebotomist and you're collecting a test, and one of the tests is bilirubin, we don't want to expose that test. Once that blood comes out of the body and is in your tube, we want to shield that from light, because we know that if we don't shield it from light, that light is going to start breaking down that bilirubin, and by the time you get it to the lab and they spin it down and they go to do their test of bilirubin, that bilirubin could be falsely lower than what it really is because you have not shielded it from light. And we'll talk about that, ways in which you can do that, from drawing the blood in an amber colored container to taking tinfoil or some type of something and wrapping it around your tube to protect that tube from light as you're transporting it from your patient's room down to the laboratory. So still talking about digestion, we're talking about insulin, right? What is insulin, right? We're learning that it is produced by the aisles of Langerhans that's in your pancreas. There's these very small areas in your pancreas that produce insulin. And so when you have diabetes mellitus, the insulin comes out, right? And insulin tells your body that we need to take that glucose that's flowing around in your bloodstream after you've eaten a meal, and we need to store it in the body cells, right? So with little or no insulin, then that insulin is the thing that tells your body to, hey, my glucose level is high, I just ate some pancakes, we need to get this insulin level back down to its normal levels, because this is the way we keep homeostasis, right? So we send that insulin out. The insulin's job is to shuttle that glucose into the cells. Well, you can imagine, if for whatever reason you're not producing enough insulin, then there's not going to be enough insulin to tell that glucose to get into your cells, which means the glucose stays in the bloodstream and builds up, so you have elevated glucose levels, right? So there's two types of diabetes. There's diabetes mellitus type 1, okay? It's usually described as insulin dependent. And strangely, this is the one that we usually see early onset of. And in other words, usually younger people, if you know somebody that has type 1, typically you see this in children who, no matter how much they eat, they're thin. And it usually happens, they find out about it when they're a young person. And unfortunately, it can't be controlled with diet alone. You can't just tell your young person, your teenager or younger person, once they've been diagnosed with it, to go out and change their diet and exercise and lose weight, and magically they can have this be better. It doesn't work that way with type 1. With type 1, usually it takes insulin as the best way. Now, of course, watching what you eat and being healthy, exercising, doing all these things can help, but it's not going to change it, okay? And it is seen as the more severe type of diabetes. Okay, diabetes mellitus type 2 is usually described as non-insulin dependent. Now, back in the day when I was a lab tech and I worked in the hospital, we usually refer to this as adult onset diabetes. Because typically what happened was we saw this where, you know, maybe as people got older, their diet was not good, and as they aged, they didn't exercise as much. They were losing some muscle mass. They started to gain weight, and as they did, and their diet was worse and worse, and they gained more and more weight, and they were very what we refer to as a couch potato. They developed, as an adult later in life, adult onset diabetes, which was type 2. And they really didn't need insulin typically to control it. Typically what would happen was the doctor would put them on a diet and try to get them to start exercising and losing weight. That's why we talk about late onset. And it could be controlled by diet. It was less severe. It didn't cause the damage for as long a period of time as type 1 did. But the problem as time went on, and this is one of the things that led me into public health, was as I was working, I was one of the owners of Durable Medical Equipment Company, and we had to code equipment. So if there happened to be a piece of equipment that a person needed, a walker or diabetic shoes, we would code it with a code for diabetes, for type 2 diabetes. And we referred to it as adult onset. We had a letter come down from the Center for Medicare and Medicaid Services and from a lot of different places, insurance companies and things, that saying that we no longer wanted to refer to it as adult onset because now we were seeing it show up in children, which at that time was really literally unheard of. If a child had diabetes, it was almost always type 1. I'm not saying that it was 100% never seen, but it was rare, very rare, to see a 10-year-old or 12-year-old diagnosed with diabetes mellitus type 2. But now we were seeing this. And as a lot of us now know, it's because we were having, obesity was showing up in younger people, and it was a problem. So now we don't refer to it as that. It's usually referred to as non-insulin dependent. It can be controlled with diet and exercise. And so if you know someone in your family that has been diagnosed with type 2 diabetes mellitus, you really want to encourage them to get with their doctor and have their doctor and maybe a dietitian help them with a good healthy diet and a doctor approved exercise regimen so that they can lose weight and get to a more healthy weight and eat a more healthy diet, because you can rectify this. You can change this. Okay. So here's another one of our critical thinking and higher learning activities. So again, this is a little activity. So what I want you to do is pause this, read through this question, and see if you can answer it. Okay, because these are really good tools to help you study for your test. Okay, moving on to the urinary system. So disorders of the urinary system. So we have acidosis. You have respiratory acidosis, which is usually goes along with like a collapsed lung or a blocked respiratory passage. And because you're not breathing in properly, it can cause the pH to lower less than 7.35, and you can be in acidosis. That can come from something like respiratory acidosis or metabolic acidosis, which is, there's a variety of causes for that, and it can result in renal failure. And then you have alkalosis, which is a pH of more than 7.45. Hyperventilation. You've seen people that hyperventilate. That if you hyperventilate for too long, it can lead to alkalosis. Urinary tract infections can lead to it, and kidney stones. So remember, there's acidosis, which is a pH less than 7.35, and alkalosis, which is a pH of more than 7.45. You don't want either one of these. Neither one is good. And so these are some of the disorders that can cause one or the other. So laboratory tests for different urinary system disorders. Of course, the first one we think of is a urinalysis, a UA, right? So when that urinalysis comes down, it's usually a set, and we'll go over this in lab, of tests that's done. We're going to check the osmolality, which is the pH, the specific gravity, right? We're going to see what that specific gravity is. The more material, so to speak, whether it's protein, glucose, cells, or whatever that's in that urine, and you guys seen urines that are darker, like in the morning they're more concentrated, that specific gravity is going to go up, and that morning urine is more concentrated because you have slept during the night and that urine has sat in your urinary system, in your bladder, and it has really concentrated down, right? Because sometimes during the night you're not taking in any water, so when you wake up first thing in the morning, you could be a little bit dehydrated from not consuming water for that amount of time. So your urine is most concentrated first thing in the morning. I'm sure a lot of you will notice that when you get up and go to the bathroom. Well, that specific gravity on that morning urine is going to be much higher than if you collected a urine in the middle of the day, you've been drinking a lot of water all day long, and you go to the restroom, that urine is going to be a much lighter color, okay? And that specific gravity is going to be less. We're going to check the pH of that urine, right? And we want it to fall within those set normal ranges. We're going to check for things like protein and glucose, because if a patient is spilling a lot of excessive protein or glucose into the urine, that could give us a red flag that something's going on. And then cells that we can look at under the microscope, because you will do that initial observation of the urine and you'll record that. You'll do your specific gravity, you'll record that, you'll check the pH, and you'll look for chemical substances in that urine, and you'll record that. Then you may spin that urine down and get a little sample of the concentrate at the bottom of your tube that you spun it down in, put it on a slide, put a cover slip on there, put it under the microscope, and you're looking for things like intact red cells, intact white cells, bacteria, trichomonas, and other things that are signs and red flags that something's going on with your patient, and then you would record those and the doctor would see them. So you can also culture your urine looking for bacteria. You can, again, we look for all these different analytes inside the urine, like electrolytes and things like that. We're also, we can draw blood and look for things from our blood tests, like electrolytes, like albumin, like blood gases, that are also going to give us a clue that there's something going on with our urinary system, right? Because, like we talked about earlier when we were talking about acidosis and alkalosis, if your kidneys aren't working properly, it can cause an issue. And you can tell that sometimes from looking at things like blood gases. If you're spilling, if your glucose is high, if your electrolytes are out of whack, your sodium, potassium, chloride, and bicarbonate, this can be a telltale sign that you're dehydrated, or that something's going on with your ability to excrete your urine. And then there's a creatinine clearance. This is a test to see the degree to which your kidneys are filtering out that creatinine, which is a waste product from metabolism. So moving on to the endocrine system, these are a multitude of different disorders that are dealing with your endocrine system. all the way from Cushing's syndrome down to Gorder and all the stuff in between. So you want to make sure you pause this and kind of look at each one of these so you'll understand them. And then there's the different diagnostics tests for the endocrine system. Whether we're doing a chemical analysis, which we draw blood and we would check your glucose, your insulin, your renin, right, serotonin. All these tests can give us a clue or give us a red flag to show us that something in the endocrine system's not working. You know, if you're not producing enough insulin, then we may see that in your glucose results or your hemoglobin A1C results that give us a telltale sign that there could be an issue with your insulin, right? Whether that's type 1 diabetes or type 2 diabetes or something else, right? And then the hormones that are produced by your thyroid. If you're not producing the correct hormones at the correct level, then it could tell us that you're having problems with the function of your thyroid. It could be hyper or hypothyroidism. So the gland that secretes the antidiuretic hormone, ADH, or vasopressin, in which this decreases urine production, is in the pituitary gland, right? And so diabetes insipidus is a condition in which no ADH is produced. So that antidiuretic hormone, ADH, is not produced in cases of diabetes insipidus, right? So individuals with diabetes insipidus do not have high sugar levels in the blood, okay? So you got to remember that in that endocrine system, we're talking about hormones, right? Whether it's insulin, whether it's your thyroid hormones, T4, TSH, T3, and these hormones have jobs to do. And if you're not producing the correct amount of hormone, like the ADH hormone, okay, then you could have that diabetes insipidus, okay? Okay, so the gland that secretes calcitonin is the thyroid gland, right? And the function of this is to regulate the amount of calcium in your blood. So again, back to that homeostasis, right? A lot of these hormones job, just like we talked about, insulin comes out and you just ate a meal high in sugar and your sugar levels in your blood's high. The insulin, which is a hormone, comes out, right? It tells your that glucose to go into the cells so that that blood glucose level can go back to normal. Same here, right? This hormone is secreted from your thyroid gland, right? And it functions to make sure that the calcium level in your blood is regulated at a certain amount. So the gland that secretes melatonin, right? We are going to go through all these, not every one because the endocrine system is quite massive, but melatonin is that pineal gland, right? So these are dealing with your circadian rhythms, right? And it is talking about repeating once every 24 hours. And it's pertaining to daytime and nighttime, okay? And have you ever heard that expression, you get your days and nights confused? There's lots of research out there that shows, you know, that's why they talk about not watching television at night before you go to bed. It disrupts your sleep. And we know that melatonin, right, is that thing that helps us go to sleep, right? The diurnal hormone levels, they fluctuate with the time of day. And why that's important to us is because these are tests that need to be drawn at certain times. So if you're talking about the diurnal hormone levels and we're drawing those levels, those are usually drawn in the morning, okay? And then melatonin is a diurnal hormone, and its secretion is inhibited by light, right? Its levels is lowest at noon. So of course, melatonin is the thing that helps you go to sleep. So that's why they tell you that you shouldn't be watching television or looking at a screen at night, because that light is going to lower that melatonin level. And so then you're not going to have the correct level of melatonin, which means it's going to decrease your ability to go to sleep. So this is why it's important, guys. Main thing is it's important to us because we don't want to have that light coming in at night, because then we don't get the melatonin, and then that means that we don't sleep as well. So make sure you take that in consideration at night when you're, because sleep is vitally important to us. It's when we restore our body and we heal. And if you're looking at those screens, whether it's a television or a computer or your phone, it's going to decrease those melatonin levels, which is then in turn going to make you have trouble going to sleep. So give yourself some time where it's dark. Our body really goes off those circadian rhythms. And that, back when, in those times when there wasn't a lot of electricity and things to watch and all that, people just slept better. Because if you've ever been out camping or somewhere like that, and most people who are out camping are going to go to bed shortly after the sun goes down, and then they are awakened by the light of the sun coming up, and you will notice that it kind of resets your clock, and when you get home, you sleep better. So, and it's important to us as phlebotomists, because this could, when we're have orders from physicians on these hormone levels to check these hormone levels, we wouldn't want to draw a melatonin level at noon, right? Because that's going to be at its lowest. So, and then when we talk about these diurnal hormones, we won't usually draw those at 8 a.m. So the reproductive system, disorders of the reproductive system. There's cancerous tumors, whether you have a tumor on your testicles or a tumor on your ovaries. There's infertility issues. There's cysts. And then, of course, we have sexually transmitted diseases and disorders, everything from gonorrhea to AIDS, that we will get, that we want, that there's tests for, that we can, again, diagnose, monitor, and treat our patients. So diagnosis tests for reproductive systems are as follows. You want to read through these. Everything from genetics, having to do with Downs analysis and things like that, semen analysis, all the way down to microbiology stuff, cultures, to, of course, biopsies and pap smears, down to blood tests like hormone levels, and different kinds of tests like the RPR, the test for things like syphilis. So, and then the PSA, which aids in diagnosing of prostate cancer. So make sure you understand the diagnosis tests that are done for those reproductive orders. And then moving on to the lymphatic system, we see disorders like tumors and infections and different immune diseases. And then the laboratory tests performed for that lymphatic system. We look at things like blood samples and bone marrows, all the way down to cell surface marker analysis to tell if WBCs are immature, as in cancer, okay? And then there's the lymph nodes, right? Sometimes they'll remove those lymph nodes for analysis. You'll see them whether you're looking under the microscope. I'm sure you guys have heard sometimes if a woman has breast cancer and they do a mastectomy, they may take some of those lymph nodes as well, because they want to make sure that that cancer has not moved in to that lymphatic system. So in summary for this chapter, okay, we've done all these things. And again, you guys want to make sure that you hit home on these. Make sure you want to know these. You're filling out those review guides. You can rewatch this on anything that you have an issue with. And of course, as always, if you have any questions that your textbook, that these PowerPoint slides and other things that's on Canvas are not answering for you, there's multiple ways that you can reach out to me, and I'll be more than happy to help explain something or help make sure you understand, okay? So make sure that you go through these, that you understand that defining words commonly used in the lab, all the way down to listing common diagnostic tests associated with each organ system, and that you know what those are, okay? So you guys, this is chapter 6. We already have chapter 1 out. So again, read your chapters in your textbook, watch these PowerPoints, and fill out your review guides, okay? And make sure you're checking your tentative course calendar so you will know when things are coming up, okay? Stay on top of it, and I'll see you in the next video.